Hello everyone and welcome back to my playlist of pathology. Today we are going to start the acute inflammatory dermatosis. मैंने आपको पिछली वीडियो में बताया था डिटेल में कि skin disorders are divided into acute disorders, chronic disorders and so on and so forth. So the first disease that we will cover today is urticaria. It's of the acute nature and we'll discuss urticaria today. Thousands of inflammatory dermatoses exist. Thousands of them exist, challenging the diagnostic acumen of even an experienced clinician. You imagine how difficult is this to identify the correct skin problem? Thousands of them are there. In general, acute lesions defined as days to several weeks in duration. Of course, they are called acute for this reason. They are characterized by inflammation, edema, and sometimes epidermal, vascular, or subcutaneous injury as well. Acute dermatoses are often marked by infiltrates consisting of mononuclear cells because this is inflammation. Neutrophil are not there routinely. That's an exception of acute inflammation. In all other parts of the body, if there is acute inflammation, neutrophils are the first one to enter, but here the mononuclear cells, okay? Unlike acute inflammatory disorders at most other sites, it's the mononuclear cells. Remember this, okay? Macrophages, monocytes. Some acute lesions may persist, transitioning to chronic phases, but most of them are actually self-limited. The first one of them we have to cover today is urticaria, which is in general also known as hives. It's a common disorder mediated by mast cell degranulation. So you have to consider histamine, 5-HT, all these are the major players, mast cell release. And this leads to dermal microvascular hyperpermeability, and you know the mode of action of mast cells as it happens also in the allergic reactions. It degranulates, releases histamine, which increases the vascular permeability. As a result, what happens that there are erythematous यानी red looking, edematous यानी थोड़े से सूजे हुए, and pruritic यानी उसमें थोड़ी सी खारिज भी होगी, wheals in the body, and this is how the lesion basically appears. So if you just Google it up, write urticaria, and you will have all these images. You see, इस तरह से अचानक से जो allergy reaction होता है. So if you look at this image, you can see that basically there is a little reddish. खारिश इसमें है कि नहीं वो तो हम नहीं बता सकते, but यहाँ ये बंदा खुजा भी रहा है, देखें. But it is a little edematous as well. So ये different forms हैं urticaria के. It can come in different flavors, and they are particularly showing that the person is वो ना खारिश कर रहा है, देखें, तो pruritic है. Now, in most cases, urticaria seems to be an immediate hypersensitivity reaction in which the antigen, जो भी antigen है, वो antigen कुछ भी हो सकती है, can trigger the mast cell degranulation by binding to the immunoglobulin E antibodies attached to the mast cell surface. So, ये एक general principle भी है. And this is how basically allergy works, that there is an antigen and this antigen activates the mast cell via the IgE, and this is how the mast cell degranulates its stuff, largely histamine. Responsible antigens can be viruses, they can be pollens, food, peanuts वगैरह, insect venom, या कोई स्कॉर्पियन ने बाइट कर लिया. IgE independent urticaria also can result from exposure to substances that directly incite the mast cell degranulation. So there, IgE independent, the name indicates IgE will not be involved. Okay, वो बहुत सारी दवाइयों से और एंटीबायोटिक से हो सकती है. In vast majority of cases, no clinical cause is discovered with extensive investigation. आप ढूंढ के थक जाएंगे कि स्टार्ट कैसे हुआ था अर्टिकेरिया, पता ही नहीं चलता. Clinically, there is no age limit, but usually it is seen between persons who have good immune system, because it requires immune system for the reaction to happen. Mast cells ही सही काम नहीं कर रहे होंगे तो urticaria कैसे होगा? Individual lesions usually develop and fade within hours, but episodes can persist for several days or months. Lesions range in size from small to larger, erythematous, edematous plaques. Again, look at the picture. There are different flavors. It can involve the whole area. You see, it can involve a very small area depending upon किस जगह पे antigenic exposure था. They may be localized or particular part of the body, or they can be generalized. In a specific type of urticaria, termed pressure urticaria, lesions are found only in the areas exposed to pressure, such as the feet or the buttocks. These sometimes examiner पूछते हैं because it's a very unique category. Although not life-threatening, severe pruritus and the social embarrassment of urticaria can compromise the quality of life. सोचें ना, सबके सामने आप खुजा रहे हैं बार-बार, अजीब सा लगता है ना. Most cases respond to antihistamine because histamine is the major culprit. यहाँ mast cell से क्या निकल रहा था? Histamine. So you block histamine and usually the things are fine. Okay, but sometimes if the disease persists, you may also need to think about blocking the IgE by immunosuppressive drugs, because this also is part of the problem. So you have to target mast cells, histamine, you have to target IgE, and usually this is a self-limiting disorder. Okay, so pretty simple, wasn't it? The first thing to begin with, skin disorders, the simplest thing, urticaria. We will obviously climb up the ladder of difficulty, and the next disorder that we have to cover is the acute eczematous dermatitis. So